Hey ladies, how are you today? It is Fix It Friday, and I promised you some quick tips on Fridays. So this is what we're gonna do. Today we're gonna do part 2 of hip flexor sweep help. So some of you were talking about problems with your hip flexors, actually quite a few of you, problems with your hip flexors with your sweeps. And last week we talked about just some things to think about during your sweeps before you rush to thinking it's a major hip problem. Which, yes, you might have a hip problem, but think of technique. How are you doing your sweeps, okay? How are you performing them? Look at your technical skill level at that moment. Bring your partners close to you so that you're not trying to sweep them with just all this force into the hip flexor with this long lever arm and then this person on you that you're trying to get over and muscle over. So improving on your distance between your partner, that's step 1. Step 2 was to focus and understand the importance of redefining how your hip works during that moment by isolating out some specific movements outside of training and spend some time with your problem areas to improve them. It's not easy, it's frustrating, it's crappy because we feel like we're doing these awesome things for our body by training jiu-jitsu and getting strong, physically fit, learning an awesome skill, and that should be enough, right? But it's not always enough, and especially as we get older or depending on what we did, you know, just different issues come up. It's a physically taxing sport in very weird ways. So you need to do things outside of training, especially if there's a problem area. And with a hip flexor issue, that would be considered a problem area for you that you would want to spend some time outside of training focusing on improving the mechanics of your hip. And that's what we talked about last week. Improving that glute med min activation and isolating out and finding your specific exercise and your fatigue level for your reps, for your sets, okay? This week, we're going to talk about how important the core is and how your hip flexor will take over if you have a weak core and if that's not doing its job in the moment. Maybe with your sweeps, you're pressurizing too much, you're loading up your abdomen with breath, and then it can't engage properly. So that's a whole nother aspect that I probably will address next Friday for Fix It Friday. We're gonna address breathing during sweeps, okay? So, and I literally just came up with that in the moment. This is so fun. I love doing this. Okay, so anyway, back to business. So we have your technical aspect of your sweeps. You have your hip strength for your stabilizers and your glute muscles. And then you also want to consider your core, okay, the activation. And next week I'll address the breathing. So the activation of the core, one really quick, simple way to assess your own core strength is to get on your back with your knees in a 90-degree position. Well, your eventual goal is to do that. So that's what I'm going to show you now. I'm going to show you how you can assess your core. So you can literally get on the floor and assess your core right now. And then I'm going to show you how you can use that assessment to develop a little exercise for yourself that will challenge you, one exercise that you can add in during the week, okay? So if you have an exercise for your hip from last week, you add in this core exercise for this week, and you'll give yourself a really well-rounded help and assist and get you on your way for that, to relax that hip flexor during your training. Okay, so what you're going to do, get on your back, knees bent, just hands by your side, and relax. All right, so you guys know by now, and some of you don't know because you're new, that my passion is the pelvic floor. And I will tell you, and research will tell you, and any pelvic health therapist will tell you, your pelvic floor is part of your core. So that will be part of your assessment here. So bringing in that pelvic floor with you includes tightening around your openings and bringing it in like you're lifting in away from the outside, like you're pulling something inside of you, all right? Like a little, like you picked up a penny and you just want to bring it in, okay? So just like that. All right, so you're squeezing that pelvic floor, and then to engage your abdominal area, the abdomen part of your core, what you can do is place your hand here, okay? I'm going to turn so it's easier. Okay, so you're here, my hand is here, all right? I'm just relaxed right now, and what I'm going to do is breathe out, and as I breathe out, I'm going to contract in, okay? So here I go. okay? Now that's engaged, and I can breathe, I can talk, and everything's good. My pelvic floor came with me, and then I'm tightening through here, okay? That's step one. So make sure you can engage things first. If you can't do this, this is where you'll start practicing. You'll literally pull your pelvic floor in and engage your abdomen. That's all you'll do if you can't do that. And you'll practice that. Maybe you're holding it for like a 2-second count at first, and then you increase that rep to 5 to 10, and you just start really working on activation on both sides of your abdomen, feeling this whole sort of natural binder pulling in and shrinking you in, and that's that contraction you should feel, okay? Everything's just being conjoined together and compressing in, okay? Pelvic floor, tighten in. All right, so what you can do now, after you've engaged that, you can do a little activation of that rectus muscle and flatten out this area through here, all right? So now you have your pelvic floor, your abdomen's engaged, as well as that rectus muscle, and now I'm flat to the floor, but everything's tight, all right? So if you can't do that and hold that for a good 5-10 seconds, then that's where you start. You add this into your everyday exercise outside of training to engage and teach your core how to activate, all right? You can also practice this then in sitting. You can practice this with, let's just stop there. Practice it in sitting, practice it in standing, and engaging your core if you have trouble doing this. Okay, so then the next step is holding all of that, pelvic floor, abdomen, rolling it back, and then trying to lift one leg, and then lift the other leg. Okay, so what you're seeing here is me keeping that back flat. If this is an issue for you, what would happen is as you lift here, this might be okay, but then you go to do this and it's like, then that back starts to arch. Typically, that's what will happen. You may have a little shifting of the hips and then an arching of the back, okay? So this is too tough of a core situation for you. That's above where you are at currently. So you would return to this position. Sorry, my nose is super itchy. It's all the mask wearing. Okay, so pelvic floor, engaging, roll it back, all right? Lift this leg. Now, if that 2 leg was too much for you, you would stop here and try to push it away from you and bring it back, okay? And then this could be an exercise for you. Really controlled, because you're challenging yourself on the edge of your limit. You're finding your limit, which is super, super cool. This is how you find where you are at, okay? If that was too easy, then of course you could come up here and do like that, all right? And then there's progressions from there, but this is, this is basically what I want you guys to do for this quick little self-assessment. Pelvic floor, squeeze it in, roll it back, bring a leg up, bring the other leg up. If your back arches, bring that other leg down, squeeze everything in and out, and then just make that an exercise for yourself, okay? So hopefully that helps a little bit. And I know that engages your hip flexor, but as you're doing that, you're practicing engaging into that hip flexor, but you're making your core do what it needs to do when that hip flexor is moving. Okay, so this is huge. Like, so find your place. If you have a hip flexor issue, if it's hurting the hip flexor on that side when you do it, message me, okay? Because we need to talk a little further on what's going on there. Maybe you need a little bit more help on performance of it or what's going on. So, okay, hopefully that helps. We have some ladies that joined us, which is super exciting. We have Justine and Joan and Brooke, Olivia and Brittany and Robin, Elisa. Hey, ladies. I'm so glad you guys were able to join. I didn't think anybody would be able to in the middle of the day like this, so that's super cool. Awesome. Hey, Suji. All right, if you just joined, I just finished because Friday's a quick day. So you can go back and watch, and it's just a quick assessment for the core, and hopefully you're all able to find a little exercise for yourself. Like I always say, find what your limits are. Listen to your body. I don't like to say do 10 or 20 reps. I like to say do as many as you can and feel really tired in your core, and that's your number that you would then repeat. Okay, so whether that's 6, 7, or 11, then you would repeat that 11 times if 11 was your fatigue point. Okay, hey Brenda. So I hope that helps. I hope that makes sense. You know, just well-rounded hip strength and core to help relieve that hip flexor, and do your best to get these in outside of training. That would be your best, your optimal way to help that issue. Sometimes it just takes that a little extra effort outside of training to deal with the problem area. Okay, guys? All right, you have an awesome Friday and an awesome weekend, and I will talk to you soon. Bye.